Welcome to the Dental Hygiene Restorative Clinical Examination Review. This presentation is intended to familiarize you with the exam process and paperwork prior to attempting the examination. It is to your benefit to read and familiarize yourself with the information provided in the candidate manual. Being well prepared consists of understanding the policies and procedures of the examination. The candidate manual and examination forms are available for download via the adextesting.org website. Downloadable forms are for reference only. Original forms are provided at the exam site for use during the examination. A list of required instruments and supplies can be found in the candidate manual. However, CDCA Reb CETA does not provide instruments or equipment for candidate use. Do not assume that all exam sites have extra instruments or equipment available for use or for rent. Refer to the site info sheet available at adextesting.org for site-specific infection control policies, school-provided supplies, equipment availability, and more. Contact the exam site host school directly with any questions you may have pertaining to information contained in their packet. CDCA Reb CETA hosts pre-exam webinars for students and faculty. This is a great way to learn about the exam process and have your questions personally answered by CDCA Reb CETA staff. Candidates who attended a webinar say they feel better prepared for the examination. Educators and non-student candidates may contact us via the adextesting.org website to join a scheduled webinar. Examiners use the following materials and instruments for grading: Johnson & Johnson Reach Waxed Dental Floss, Front Surface number 4 or 5 Mouth Mirror, UNC 1 through 12 Periodontal Probe, Hugh Freedy 2R 2L Pigtail Explorer. An optional question and answer session is held on-site prior to your scheduled examination. The Chief Examiner will briefly review the examination processes, answer any questions you may have, and provide you with your candidate ID badge and an exam packet containing a prep envelope. Note that candidate use of electronic devices is strictly prohibited during any aspect of the examination, including the question and answer session or clinic tour. Clinic tour is conducted prior to the on-site question and answer session. The tour is optional. However, it would be beneficial to attend if you are unfamiliar with the host school or clinic layout. Specific infection control policies, disposal of biohazardous materials, location of supplies, and emergency protocols will be discussed, as well as instructions on how to properly set up your operatory. During the tour, the school coordinator is available to answer equipment and school-related questions. After the tour, locate your assigned operatory and address any exam-related questions with the Chief Examiner. Grading examiners participate in examinations throughout the season. To maintain an unbiased examination, anonymity is maintained between you and the grading examiners before, during, and after the exam. The Chief Examiner oversees the candidate clinic and upholds CDCA Reb CETA policies and procedures to ensure a calm testing environment. The Chief Examiner answers exam-related questions and will address any problems that may occur. Although not a grading examiner, the Chief Examiner will evaluate the Typodont during check-in to ensure that it meets the prescribed criteria and will be in contact with grading examiners throughout the exam process. In the candidate clinic, a floor assistant is available to help with any school-related equipment problems during the examination. However, you must notify the Chief Examiner immediately if you are experiencing a problem. Time compensation may be given for a problem not resolved within 5 minutes only if the Chief Examiner is aware of your situation. The Exam Technical Coordinator, or ETC, oversees the check-in and check-out processes to ensure that CDCA Reb CETA policies and procedures are upheld. The ETC is also responsible for processing candidate retakes. A school coordinator is the school's on-site representative designated to assist exam personnel as needed. The school coordinator or someone familiar with school policies and equipment will be conducting the clinic tour after the on-site question and answer session. At clinic entrance and throughout the exam, you must be dressed in proper clinic attire and have your candidate ID badge visible. Bring your armamentarium and personal belongings with you. Mask, gloves, and protective eyewear is required. However, host schools may have additional requirements for personal protection. Loupes are acceptable in lieu of protective eyewear. You will have 30 minutes to mount your Typodont, replace the existing teeth with the assigned preparations, and set up your operatory and instruments. Verify that your handpiece, equipment, and operatory are functioning properly. Any questions or concerns should be addressed with the Chief Examiner during this time. Once you've completed the setup process, you may leave the clinic. However, you will not be allowed to re-enter. Remain in the waiting area until re-entry is announced. Submit the required Typodont that meets the following examination criteria. Accidental ModuPro 1 MPR320 Typodont with full dentition of 32 teeth. All teeth must be virgin without sealants or restorations. Exam-marked preparations and adjacent teeth are anatomically correct and secure. It is in your best interest to present a Typodont that is free of hard or soft tissue damage. Although tissue damage is not evaluated at check-in, tissue damage present at grading may result in a point penalty. You will have one Class II MO or DO maxillary molar preparation and one Class II MO or DO mandibular molar preparation at your operatory. Replace the original Typodont teeth with the exam-marked preparations. Secure the preps, but avoid over-tightening to prevent breaking or stripping the screws. Once the prep teeth and adjacent teeth are secure, stow your screwdriver. Label the top side of the Typodont with your candidate ID number. The Typodont must replicate the natural positioning of a patient during actual treatment procedures and be maintained during your examination. In this slide, the dashed line represents the rod post. The Typodont replicates the natural treatment position of a patient in the chair. The maxillary arch is positioned in such a manner that direct and indirect vision must be used when working. In this slide, the Typodont is positioned too far back. This position allows an unfair advantage for the candidate and would not be possible with a patient. If you are concerned about the position of your Typodont, ask the Chief Examiner. A4 or A4B Composite and A1 Flowable are the only shades required and accepted. Opaque shades are not acceptable. The Chief Examiner verifies composite and flowable materials during setup. During check-in, the Chief Examiner verifies that the Typodont meets the prescribed criteria and the anatomically correct placement of exam-marked preparations and adjacent teeth. If all criteria is met, restorative materials are randomly assigned for each prep. When you return to the clinic, your restorative assignment sheet will be at your operatory. Review your restorative assignments for accuracy before beginning any procedures. Notify the Chief Examiner immediately of any discrepancies. You will receive an Instructions to Candidate form, referred to as an ITC, when you have an incorrect composite or flowable shade, Typodont rejection, replacement of an assigned preparation upon setup, or incur a late penalty. If received, contact the Chief Examiner with any questions about this form. A verbal announcement will be given 5 minutes prior to the conclusion of the setup time and the clinical examination. A candidate who continues to work beyond the stop working announcement will incur a point deduction for each minute they remain in the clinic. Have a plan and manage your time wisely. Decide which restoration you will complete first and how much time it will take to finish each restoration. Although there may be other clocks in the candidate clinic, There is only one official time clock identified by the official clock sign. During the examination, refer only to this clock when monitoring your time. If you experience difficulties with school equipment during the examination, notify the chief examiner immediately. Time compensation may be given for a problem not resolved within 5 minutes, but only if the chief examiner is aware of your situation. Polishing agents may be used but are not recommended. If used, thoroughly remove any residue from your finished restorations so as not to impede the grading process. Petroleum jelly products, such as Vaseline, are strictly prohibited. To avoid overflow, water is not accessible through the operatory air-water syringe or high-speed handpiece. However, water cups are available for your use during the examination. Avoid placing your armamentarium on the chair since your Typodont should replicate patient positioning during actual treatment procedures. When finished, remove your Typodont from the rod post and place it in a container marked with your candidate ID number or affix your assigned operatory to the top of the container. You will have 20 minutes to disinfect and set up your operatory for the next candidate. Follow the school's policy for disposal of biohazardous materials, such as amalgam scraps, as indicated in the site info sheet available on the adextesting.org website. If an examiner determines that a surface sealer, unfilled resin, glazes, or flowable has been applied to any area of the finished composite restoration, the final grade will be a score of no greater than a 2 for the categories occlusal, margins, and proximal. CDCA REBCETA is a testing agency and not a licensing board. Successful completion of an examination does not constitute licensure in any state. It is illegal to render patient treatment until a license or certificate is issued by the state. Contact the individual state board or state-designated licensing authority for licensure information. Preliminary results are available on-site. However, finalized examination results are generally posted online approximately 72 hours after the last date of the examination. If unsuccessful in your examination attempt, you will receive a restorative performance evaluation listing the specific criteria in the categories receiving a median score of 2 or 1. These are the areas of deficiency. The retake exam is a separate examination attempt and included in the total number of examination attempts. Candidates who fail only one prep are eligible to retake the exam on-site. The on-site retake assignment consists of the same prep and restorative material as the failed prep of the individual candidate's clinical examination. To secure a space in the on-site retake session, notify the exam technical coordinator, preferably within the time frame announced during the Q&A session, but no later than the last scheduled clinical grading session. Payment is required to guarantee registration in the retake session. Once payment has been processed, a clinic time will be assigned. Retake sessions are generally scheduled the last day of the exam. A sign will be posted indicating the time that you may pick up your Typodont after grading is complete. If you cannot be on site at the scheduled pickup time, please let the chief examiner know. At the assigned time, you will remove both exam-marked restorations from your Typodont and place them inside the small envelope, labeled with your candidate ID badge or number. As a reminder, photography of finished restorations or any aspect of the exam is strictly prohibited. Return the prep envelope along with any ITC forms, unused candidate ID badges, and your candidate exam packet to exam personnel. CDCA REBCETA utilizes an online post-exam survey to gather feedback from candidates about their exam experience. The survey is anonymous and all comments are reviewed. CDCA REBCETA values all feedback and would like to give every candidate the opportunity to comment on their examination experience. Thank you for choosing the CDCA REBCETA examination. To ensure that you have a positive examination experience, please view this presentation as often as you feel necessary. If you have questions about any policy or procedure or comments about this presentation, please feel free to contact the CDCA Rev CETA office. We wish you success in your chosen profession.